This is the hospital MPs say others should follow.
We've got 3 assistants this afternoon, and tonight's numbers. We've got 1 support assistant.
It doesn't look much, but this board outside a ward at Salford Royal tells staff, patients and relatives how many nurses should be on duty and how many are actually on the ward.
Staff, I think, like it. They recognise it, that it's a clear indication of where the staffing levels should be and where they actually are, and that they know that the trust senior management are aware of the numbers and what the numbers should be, and if there's a discrepancy between the two, that we're doing something about it.
This psychiatric nurse, who wanted to remain anonymous, told us staffing levels on his ward are often dangerously low.
They just don't have the staff. I've had an emergency situation when I've had to call the alarm and we've had nobody respond from other wards. It's very demoralising.
Research published today asked 3,000 nurses in 46 different hospitals about their last shift. It found 43% of hospitals had a ratio worse than 1 nurse to every 8 patients, generally thought to be a red zone. Even worse, 18% had only 1 nurse for every 10 or more patients. The All-Party Health Select Committee of MPs recommends all hospitals should follow the lead of Salford Royal in a drive for openness after the Francis report into the scandal at Mid Stafford. The government agrees, but says setting standards for staffing levels isn't straightforward.
I think there's a real danger of one size fits all, because if you set one minimum level, you could find that with particular groups of patients who have acute needs, the ratio may have to be higher than that, and there is a danger therefore that you sink to that level when actually you need more nurses.
Guidance on staffing levels from the government's chief nursing officer is expected soon, and they promise more action on the Francis report's recommendations.